Hi, in this video I'm going to show you how to identify your patients with complex health within Wolf so that they can be identified as patients needing care plans for the PaCT initiative. So to start with, complex health is not listed in the problem list of Wolf. So we have to go ahead and add it. So we do that by clicking on Configuration. Once Configuration opens, we go to the View menu, go to Patient Reference Tables, and we go to Problem Index and left-click on Problem Index. We want to add a new problem to this index, and so we click on the plus sign. We're going to put in our description. We're going to call it Complex Health. So we type that in. Okay, if we had an ICD-9 code to attach, we could, but I don't really know of one that's applicable here. So we're just going to say save and close. Okay, so now if we wanted to search here, we can type in complex, and it shows a number of things that have complex in them, but our complex health is now included in our problem index. So that means that we can leave here. If we go over to my work desk, I can now apply that to a patient. So there's a couple of ways that you can do that. One is within a visit. If you're in the SOAP note, you can apply it from within the visit by typing it in to the assessment box, clicking on Add to Assessment, then clicking on that black line and click Add to Problem List. So that will add it into our problem list. Now if we click on F7 to go to her medical summary and we go into her problem list, or you can access it from the right-click menu or from within the SOAP note, we can now see that complex health was added to her problem list in 2017. If we wanted to, we can also directly add it from this screen. And the way we would do that is by adding the plus, typing in complex health, hitting enter, choosing it, and clicking on update. Now we're not going to do that because we've already got it in our problem list. Well, if we try, we'll probably get an error message. No, it adds it twice. So we don't want to do that. So we can delete one by clicking on the X and say delete it and say OK. So now we've added it into her problem list that way. But what happens if you're doing a review of your practice and looking for all of the patients that have complex health and would be eligible for the PaCT program? Well, there's several ways to identify those people, but one of the simplest is probably to go ahead and use the practice search. So we open up our practice search module, search all patients, open up demographics, choose primary MD, and choose the MD that we're working with. In this case, we're choosing a practitioner with a panel of test patients so that I can show you their information without breaching confidentiality. Okay, we're just going to run a simple panel search here to see all the patients she has on her panel, which are 4. Now, most physicians and their teams can identify at least several of their patients with complex health issues just by looking at the list of patients and their names. So if we want to do that, we can then, you could go ahead and print this list and show it to the physician, or if you're the physician or you're the team member identifying patients yourself, you can do it right from the screen. And the way you can do that is by saying, okay, well, I know Test Christine and Test Happy also have complex health. So I'm going to check them off here. We're going to go into selection. We're going to choose Add to Problem List. Okay, and we're going to type in complex health in the top. And it chooses complex health in the bottom, but we would make sure that that was the correct one. And we're going to say OK. And this adds complex health to the problem lists of all the patients that you've checked. Now, Wolf has a limit in how many it can handle at once, so if you're going to be doing a very large number, I would suggest breaking it up by first letter of the last name, so that you do all the A's and B's together, all the C's and D's together, that kind of thing. Break it up that way so that you don't crash the system. But now we can see if we go to Christine here, and if we double click on her name, it will bring up her chart, and we can see that complex health is now in her chart as well. So that's how we can use practice search to identify patients with complex health, but in the first place, and make sure we get it in their problem list. But once we have complex health in their problem list, then what do we do? Well, let's go back to our practice search module. And the reason for putting it in there is that you want to be able to identify patients with complex health that might be at risk or that are due for a care plan. So we know that we've got our list of patients with complex health identified, and that will be a work in progress that might change over time. But initially, we're going to go back here, and we've got my panelist, or this practitioner's panelist, up. And what we're going to do now is we're going to go into history, and we're going to identify all those patients with complex health in their problem list. So we're going to go into problem specific under history, okay, and we're going to type in complex health at the top, hit enter, and choose from the bottom, and we're going to choose our complex health problem here. Okay, probably doesn't matter when it was diagnosed. It does need to be currently active, just in case there's somebody whose health has improved in your panel. And then we're going to run this list. So here we go. Here's our list of patients that have complex health in their problem list. Okay, so that might be all you need to know, but we might need to know who of these haven't been in the last year. And we can see we can use a simple technique of just sorting with this column. So we can see here at a glance that the people at the top of the list haven't been in the last year, so we can do it that way. But we can do it more formally by building a search for that. So that's back up in demographics. We can add a parameter around last visit. And so we want to exclude the patients who do have a visit within the last 1 year. Okay, so we want to find the patients that do not have a visit within the last year. Okay, so again, just to review the search, we've got patients of all age, gender, as long as they're still active, assigned to a certain provider, or you can do the entire clinic if you want, but usually it's more efficient to work by provider, who do not have a visit in the last year, and who do have complex health in their problem list. So in this case, we know we had 3 that had complex health in their list, and we have 2 that do not have visits in the last year. So in this case, we could act on this list. We could print it, so print it all. We could export it through Excel, or we can say selection, select all, and we could say selection. We can add them to the follow-up list. Now, you've got to be careful about how many you would do this for at a time, but I'm just showing you what you could do. So you could have them called in either as a physician reminder or call the patient in, and I don't know why the bullet points, normally there's a selection box showing that beside that, but it's not today. You can select it as routine, and they can come in to see either the patient's attending MD, me personally, since I'm the one running the search, if I'm the team member, or assigned to a group. And then you would say OK, and those patients would be added to the recall list to come in to book an appointment with the selected person. But again, don't do that to 50 patients at once because you won't be able to handle the capacity, and your staff will be a little bit unhappy. So now, another thing we might want to do is identify patients with complex health that don't have a document on file called a care plan in the last year, or a complex care plan, or whatever it is you call it in your office. So we're going to remove the visit parameter because it doesn't matter if they've been in or not. we still want to know all the patients that have the specific problem of complex health in their active problem list. And then we want to go look at the documents. So documents is under history on the left-hand side here, and we want to use documents. And this is where it becomes important again that your keywords are consistent. And in my office, I think we call it a complex care plan, but if we put in care plan up the top, choose the drop down, we call it, so you can see there's lots of things with care. So if we want to modify that, we can ask it to have all words or both words there. And we have complex care plan in ours. And this is the keyword that we're supposed to have standardized on. You can see once somebody didn't choose the drop down and instead typed it in and spelled it incorrectly. But I know that this is the keyword that we've standardized on in our office. So we want to know the patients that do not have a complex care plan filed in the last year. And then we can go ahead and run the search. And in this case, it's all three of them. So you can see that Alice had complex health added to her list just at the visit in May. These two were added from the practice search, so it doesn't show the date that they were added. And it doesn't show the date of their last complex care plan. But what we can do is, if we want, I know that one of them's had one within 2 years. So if we run the search again, you can see that Alice Test did have one just more than a year ago. So it depends how far back you're trying to catch up on. You can change the parameter accordingly to make the search work for you. So that in a nutshell is one way to go about identifying patients that have complex health, putting complex health in their problem lists, and then using that information in their problem list to search for them and find the patients that are overdue for a visit or are overdue for a care plan, and then acting on that to either print a list or to call them in, or whatever it is that you need to do in order to best care for that patient. So I hope this video was helpful, and thanks for watching. We'll see you next time.